name is Sabine Haller. I am 38 years old from Switzerland. I'm a medical doctor and I'm currently in Agok in South Sudan. We have a hospital here with an emergency room, an inpatient department, a feeding center for malnourished children. I usually start my day at the close monitoring unit where the most critical cases are, and then I go through the other wards. It's like two different worlds, like two different medical worlds even. We don't even come close to the diagnostic facilities that I'm used to. Also, the treatment available, of course, is a lot less. It can be hard to see that diseases that we would be able to diagnose and treat at home, sometimes even easily, here cannot be dealt with. I feel somehow closer to the patient here. We don't have a lot of means to treat them. And maybe that makes me feel closer to them. I want to offer them more, but we get to the limits of what we have so quickly. We need to put the child in a blanket. It's too cold. We have a lot of severely malnourished children coming into the hospital, and many of them suffer from extreme dehydration. They need intensive care and they need a good rehydration. At the same time, they are very fragile due to their malnourished state, and it is a very fine balance to give them a good and effective treatment. Sometimes, many times, we are successful, sometimes we are not, but we have to carry on and treat the other patients. Losing a patient is always tough. To me, I never get used to it. It stays with me for the whole day. It can turn in my head. I go on with my work, but it's something that stays with me for a while. Since I started medicine, I was eager to work with MSF. Then I did my specialization. It took up a couple of years. And at one point I thought, it's now or never. But yes, it is a new world that you're thrown into with all the excitement and all the frustration and all at the same time. Luckily, there are these moments that really uplift me when they come back from severe malaria, regain consciousness, and they're talking again and they're laughing again. When the babies are rehydrated, they're being fed well and they're doing better. So these are moments that are really, really precious, and they give back so much energy. Without these little happy moments, this work would not be possible for me.